basically we're going to talk about what's contained in that document. And we have basically set a plan for all industry that we looked at to provide the same kinds of information so that they can protect themselves from harm. Within that document that we're talking about, this return to work for construction workers, we're saying that all contractors, whether you are a primary contractor for a bunch of subcontractors or subcontractors working for the prime contractor, they have to develop a formal or sometimes informal, if it's a very small job, work plan. And this work plan has to be functional so that anyone who's coming on the job follows the same rules. One of the important strategies is to try to monitor, assess, and test workers who may be symptomatic. Now, in certain countries, you may have to send them to a clinic. Here in the United States, what we ask is that if they are not feeling well, you don't go to the job site. Okay, you stay at home, you quarantine. If you are really sick, then you go to the hospital and seek treatment for therapy. But it's important that people who are sick do not go to work. And I know in certain countries they don't have all the benefits and amenities as here in the United States. They don't have maybe some health care. They may not have benefits of sick leave and other things like that. So that's an important understanding. But we have to make sure that people who are sick or expressing some symptoms of sickness or living with people who are sick do not go to the job site, because that is going to shed virus to everyone working there. We also have to improve physical distancing. In the United States, we call it also social distancing. And that basically means that at least workers on the construction site have to be at least 6 feet apart. Minimal distance. I'll show you some information later on that suggests that distance may be too short. But if you're working outside, that may not be an issue whatsoever. But if you're working in the built environment, renovating a building, getting it up to speed, returning it to service, all this thing, depending on the density of the number of workers in there, because you may have different trades, we have to be very careful that we're not shedding virus and we're not ventilating properly to dilute it and prevent work exposure. The other thing is not only shedding virus by sneezing and coughing, but we also have to worry about contact with surfaces that may have been contaminated from sneezing and coughing. Now, the virus we know can live up to 3 to 7 days, depending upon the materials that we're contaminating. So they may not be clean. So you may touch it and then touch your face and get an exposure to the mucous membranes around your eyes, mouth, nose, and that will also create a problem. That's why hand washing becomes so important. Or if you're in an area where it could be contaminated, you wear gloves. It could be just disposable latex or neoprene or any kind of disposable glove. We also have to make sure that people have bathrooms and shower areas, break rooms. If that happens, for someone like removing asbestos or lead-based paint on bridges and things like that, they may need to protect themselves from that hazard. But we also have to understand that they may be shedding virus in those areas as well. So the bathrooms could be contaminated, shower facilities or break rooms could also be contaminated. That's why we're talking more about making sure that we're cleaning and sanitizing those areas at least after every day. We'll also talk about providing respirators and other protective equipment. Now, on the job site, again, you have to look at what the risk is. Outdoors, you may not need a respirator. But if you're working with a bunch of trades indoors or in a tunnel or in a pit or somewhere else, and you're in close contact or close quarters, respirators may be the appropriate choice. You may also use other PPE like gloves or a gown or whatever to keep your street clothes from getting contaminated. They talk about screening workers for their temperatures. Now, while that may be a public health decision making, it's not always a good practical use in the work environment. Because, as I said before, those people who are listing symptoms should never come to work. So, trying to find people who are actually showing fever of 100 degrees or more Fahrenheit is really impractical. In fact, if you look at some of the statistics of people doing screenings at airports, there are less than 1% of people that actually were flying on airports and going through checkpoints that actually had fever. Now, they could be pre-symptomatic, but they didn't actually have fever. So screening workers using temperature checks may not be appropriate, and we're not really advocating this. The American Industrial Hygiene Association looked at single-use respirators, if respirators are appropriate, and they may not be in all locations. Now, these N95 respirators and those other disposable masks coming from other countries may be acceptable because of their approval and testing, but there are a lot of fake respirators on the market that do not provide protection. Surgical masks and cloth face coverings do not equate to being considered respirators. They are a means for public health protection, distancing and coming in close contact temporarily with other people, but they're not designed to protect the worker from virus. They're there to just limit people who may be pre-symptomatic, whatever, some shedding virus that exposes others. Another important thing we're looking at is making sure that everyone who comes on the job site understands what the new rules are going to look like. So they have to go through a site orientation, and they have to understand the training associated with what this virus is all about, how to protect themselves, and what personal protective equipment or other resources are necessary. We're advocating talking about toolbox talks, a 5-minute presentation just to discuss the work activities prior to whatever you're doing, whether you're doing carpentry or plumbing or you're an equipment operator, whatever it may be, is make sure that these people understand how to protect themselves. And if they go to lunch breaks or shower facilities, whatever, they also take the other precautions. We have to make sure there are sanitations or hygiene facilities. You may not have bathrooms available to you so you can wash your hands and face. So we have to use practical methods of hand sanitizer and using that and keeping it on you so that if you go into an area and then you come back out, you use the hand sanitizer once you come out. Unless you can provide gloves for people who are doing that, it may be another way of protecting people. In certain building opportunities, we're talking about after we get through this pandemic, we're going to have to clean and disinfect a lot of buildings. Okay? We have to make sure that we're removing the dirt and grime first using soap and water. Very simple technique. But once that's clean, then we can do the disinfection. We can't do it all at once. It's a 2-step process. We clean first to remove all the organic material, all the grime and dirt, and then we can sanitize with a disinfectant product. We also advocate the use of a checklist for administrative controls to make sure that you're doing everything you can to protect workers while they're on the job. And where there are gaps, you need to discuss with the subcontractor or the prime contractor what those gaps are so we can close that and protect workers. We also have to have supervisor, administrative monitor workers to make sure everybody's following the rules. Because if they don't follow the rules, how we expect to protect workers? I talked about the US CDC guidelines. They are public health guidelines. They're not designed for occupational health and safety on the job site. But they're there. They impact the job and the cost of the production the contract work. Absolutely.
Yeah, engineer, I guess I guess you are okay with that. Okay, can we have a question again from Galaxy Note 9? Galaxy Note 9. Galaxy Note 9, please, can you ask a question? Yes, unmute yourself from that end so that it will flow. Galaxy Note 9, you can talk now. We cannot hear you. Okay, fine. Can we proceed with Obonaket? Ocheze, Obonaket, can you please ask your question?
Hello. Hello.
Yes, go ahead. Go ahead.
Yes, what I observed in construction companies, even though we are talking about this COVID and its implications, I observed that due to the reduction of number of workers, there is people losing their jobs as a result of that. Do we have any safety for those that are asked to stay home? Do we have any protection for those that are asked to stay away from the job, stay away from the office or from construction office due to this COVID-19? Do we have any protection under this safety for them? That is the question.
I think it's driven by each employer to make sure that they put the rules in place. That if you don't feel well, you don't come to work. And if you do come to work, you will be sent home. But we have to make sure that everybody understands that, because if somebody does come to work who is symptomatic, coughing, sneezing, they may contaminate a lot of more workers and impact their jobs, their livelihoods, and their families. So they understand that when we talked earlier on about the infection rate, this is a highly infectious disease. So the transmission is very easy from person to person. So everybody has to have a healthy respect. I know you want to work, but there has to be rules in place. Because if we don't, it could be catastrophic for business and for the employees as well. Because if they get sick, then they can't work and they can't support their families. So it becomes an economic problem besides a health problem. Did I answer your question?
Okay. Can we have a question from Hosea? Hosea, can you ask your question, please?
Okay. Thank you again. Okay, so you said something about keeping a log of people who visit the site. So I want to apply that to the practical example. So say you're the manager of a shopping mall, and in a country like Nigeria where surveillance isn't that top-notch, how do you keep track of people who visit the mall and buy stuff and it's a pretty big mall? So is there a way you can get information from those people without infringing on their privacy, you understand?
I'm having difficulty hearing the question, but I think he's asking about how can we track people in under social, away from work. In most of the world, in the developing world, unless you are in a country like China, there is no responsibilities or requirements to say that if you want to go to a mall or to another venue, sporting a venue, whatever it may be, to report that information to your employer. It has to be a personal responsibility because they have to understand it's personal. Because if you go to these malls or these venues where there's high density populations and you get sick, you're not going to be able to work. So that's why self-quarantine is becoming very important. We've already gone through 100 days of this for most of the population. But there are people who now have gotten tired of being restricted to home and they want to get out and enjoy life. I'm telling you, at this point, it's too soon. So many malls and things like that are reopening, but again, if you are going to subject yourself to that kind of opportunity where there's high density population, you have to be wearing a respirator, not a cloth covering over your face. You need to wear a respirator because the cloth face covering does not afford you the respiratory protection that you need to prevent you from breathing in these viral particles. These are very, very small particles, 0.1 to 3 microns, which are not visible to the eye. And you can easily be exposed to people who may be sick, or a child who may be sick and transmitting it by coughing and sneezing. So you're putting yourself at risk by going to these events or places where there's high density population. So it doesn't make any sense why you would want to do that if you want to continue to work.
My question was, if you are the owner of the mall, how would you keep track of people who come in and out of the mall?
Okay.
I'm not hearing it.
Bernard, yes, he said if you are the owner of the mall, how will you keep track of people who comes in and goes out of the mall?
Nobody's going to do that kind of tracing. They're just not. Unfortunately, we don't live in a society that's unfree like the Chinese. The Chinese do facial recognition. They do temperature screens. They know where you are at all points of time. In the free society that we live in, we don't have that requirement. So there's no requirement for that to happen, and it's not going to happen. So you have to take an individual responsibility for your health and the responsibility for your family's health so that they're not getting sick and then transmitting it to you so you can't come back to work.
Yeah.
I'd like to add, as a mall owner, you can track that, but as a mall is a collection of shops, right? Every shop owner can keep a logbook, but you cannot force it, not in every country. In Nigeria, that may be possible, but for example, in Europe, we have laws, and in the US, we have also laws about privacy and so on. But there is this advice for shop owners and so on to keep a log, or inside their shop they are allowed with the necessary signalization to have CCTV and camera that records who comes into the shop, as long as it's not recorded outside the shop, because that's a breaking of the law in our countries. But you can do some things personal, but it's not only the shop owner, it's yourself as well. You go out, you meet people, you have to write down where you were, at what time, who you met, because if you have, it's like HIV, yeah? If you have HIV, you have to alarm your former sexual partners so they don't spread HIV. It's the same thing. You have to be able to say, I met this person then, and so on. 14 days back in time, because incubation time is 14 days, as far as we know, and prevent that from spreading. It's not only for yourself. You can be young and strong and so on, and the virus doesn't care, by the way, but you have friends that are in a weaker position medically, that have more risk. You have parents and grandparents that run more risk. You don't want to lose these people. These are lives. This is not only you, it's also their lives. And you can, as we said in the beginning, right, Mr. Walaka, we can counter economical loss, but we can never repay. It can never be undone to lose somebody. So that remains the main thing. You don't want to lose your loved ones. So you have to take the responsibility to do it yourself. And unfortunately, not everybody works with us. We have, as Mr. Uwalaka says, people want to get out after this long time of lockdown. We have in Brussels people coming together, young people out of protest because they have been kept inside for so long and they want to party. But they have parents and grandparents and friends that are weaker too, so they should be sensible and made aware of these things. But it is unfortunately responsibility of the persons, of every private person themselves.
I also want to make sure people understand that if we're looking at demographics, that people of color have a higher incidence of contracting the disease. We see that as almost disproportionate population of 2/3 of people of color will contract the disease versus people who are white. And we also have to understand that people who are elderly have a disproportionate population of becoming sick. So if you bring your grandmother or grandfather to the mall, they more likely will probably get sick rather than you, and then living at home transmit the disease.
Yeah, okay. We have a question from Ido. Ido, can you ask your question, please? You can unmute yourself from there. Ido?
Yeah, thank you, Mr. Emmanuel. Good morning, everyone.
Yeah.
Thank you, Mr. Bennett, for the lecture well delivered. My question is this. Since the of the pandemic of a thing, there has been so much changes in the usual work tradition. People have started working from home, some staff have been laid off, and a number of things have happened. So, and the lecture basically centered up those that are currently working, about those that are unemployed and are looking into joining more of the industries. What are the situational measures or situational skills that they are supposed to get themselves equipped with currently so as to fit into the situation of things as we have it now? That is my question.
That's a very good question. I understand from various countries like Canada, if you have migrant workers who are coming in from, say, Mexico or the United States, they have to go through an automatic 14-day quarantine process before they're allowed to work. I don't know other parts of the world, and I certainly would like to hear whether there's a quarantine process. But if you are in country and trying to return to work, there is really no process that I understand that are forcing to worker employers to actually do testing. I mean, they can do temperature testing, but
Okay. Okay, let's hear. I think we are all done with questions from what I can see here. Any other question anywhere? I can't see any hands up here. So I think we're quite well informed at this moment. Have to handle the cases of this COVID-19, especially from the construction sector down to other sectors, as the case may be. The instructions and the procedures that for 10 have explained earlier and have trained us on is something that is very easy for us to implement. But I understood very well that it's very much quite difficult most times to implement these things in the reality, because we are dealing with human beings, and it's not easy. I've seen some cases where some people, you ask them to wash their hands before they enter a shop or somewhere. They will ask you, no, they have washed their hands in their house. So they are counting on the ones they wash in the house before coming out. People are too lazy, to implement. So that may be taking us to a very critical situation from what I can see. If this virus is going to be here 2021, even mentioning 2022 is very big for my mouth to speak, but I can still say it's going to be challenging. It's going to be challenging. That means a lot of people are going to lose their life. A lot of people are going to lose so many of their loved ones because of this COVID-19. But we as professionals, as leaders who have understood the implications and the consequences of this COVID-19, I would like to know what is the best approach. I want to ask possibly the prevention advisor as can help us. What is the simplest approach for leaders like us who have understood what this virus and have understood how far? Because in Nigeria, for example, some people are saying there is no virus yet. They say there is no virus. They are making it more political, and people are dying. So there are so many implications and the complications, especially from Africa. So what do you think, we professionals, how do we try as much as possible to make sure that this training is implemented? I'm going to also, we are going to share this slide later on. We're going to share the slides so that we can take our time to study Mr. Bernard's presentation and his slide to understand and meditate and think over it and see the best possible way we can implement that. So, what is your stake for leaders, for professionals like us to do?
Well, actually, it's funny you ask, because we have this co-trainer, you know him, Mr. Raymond. And he was talking to me about Pakistan that went actually in a lockdown a week after we in Belgium went in lockdown. And he said, yeah, but people don't mind. People are just gathering and so on. And he showed me some pictures. And we discussed about genetic, possibly genetic advantage, because there were almost no contaminations there. And then I checked the numbers yesterday, and there are 5,000 a day. So it will come. You can easily see the results, which countries have finished the curve and have less contaminations, and that's a day. And the countries that are still rising and keeping high, Sweden, for example, also didn't care, and their numbers are like this now. They are having contaminations every day. I think I'm the other way around for you, but okay, you know what I get. What you get what I mean. So there was also this story in the U.S., if I remember correctly, Mr. Fontaine, that there were people that were saying, yeah, people of color, black people, they don't get contaminated. So, and there were really, this was just a joke, but there were a lot of people, black people, who went out and tried to help people who were contaminated and got contaminated by themselves because of this sad joke that was taken serious. So we need to keep making people aware. There is no other option than keep doing that. And sometimes it's frustrating. But the other side of the coin is that we are losing people. People are dying. And that is more important. And that should be the biggest motivation to keep fighting all fake news and so on. I don't know whether that is true that black people genetically are more sensitive to getting it, Mr. Fontaine. I didn't read any confirmation. I know that cultural black people come together more easily than white people, for example. And I think that is mainly the cause of the higher contamination. I don't know if you have any genetic confirmation for that, Mr. Fontaine?
There are studies that show that people of color have a much higher reported low economic wage. They're also essential workers. They're the ones on the front lines through this entire pandemic. They're the transportation workers. They're the ones that, you know, do the sanitation and everything else. And they have a high risk of exposure from this. And without understanding the controls, they were affected.
I see. I see. Okay. At this point, we have heard it with professionals that we just need to do our best to continue to spread the news, because that is the only solution for now. The awareness, we have to keep, you know, spreading the awareness. One of the first things we're going to do as professionals is in our workplaces, let's design a prevention strategy. Let's make a prevention strategy based on what Fontaine have said earlier. If you're in the construction sector, or maybe you're in another industry or in another sector, try as much as possible, study his presentation, which we are going to receive shortly after this class, and make your decisions and make your recommendations for the management to implement, and also make procedural guidelines as a professional in this field. And I think if you push it appropriately, there may be possibility of considerations and implementations. Now, for the public generally, I think the only solution we have, as said earlier, is just for us to keep spreading the news. We just have to keep sensitizing people to understand the needs to keep distancing, washing of hands, and all kind of stuff is very, very necessary. Just for me, for example, in my house, I have the sanitizer in the car, in the office, in every point. So in any contact you make, you just sanitize yourself. Yeah, that may be a little bit. But I'm a little bit confused with the face share. There is a new manufactured face share they are using in Africa, both in Ghana, Nigeria, and all that. They want transparent face share. As Fontaine said earlier on, that may not be sufficient enough to prevent some particles and all that. So what do we actually do? We have to start wearing goggles? Fontaine, I will need an answer, please.
Well, I think the problem is that we're using disinfectants inappropriately. And if we don't use it, if we have dirt and grime on a surface, we can't disinfect. We have to use soap and water first. We have to remove that surface contamination first. Then we can disinfect. If we try to do it without it, it's not going to work. And the virus will still be there because it's embedded into dirt and grime. So that's one thing we have to understand. The second thing is that there are, in the United States, registered disinfectants. And the reason why they're registered is because they know the efficacy of how they can kill the virus, okay, or disinfect the virus. That's very important. We can't just assume a product that's advertised in the media that's work. We see so much false advertising. So we have to go to a source that we can trust. And they make these things from various companies across the globe that have infected. Now, we also have to understand how they're being presented. It's how we clean is also equally important. If we take a paper towel and spray a little disinfectant and wipe it, it's not going to be clean. We're actually smearing everything across the surface. But if we take a microfiber cloth and we fold it in four and use it on a flat surface to wipe it, now we're actually cleaning it. And then we can then launder those microfiber cloths to clean it, dry it, and then reuse it. And that technique has been shown in videos. You can view it, Google it on YouTube, demonstrating the effectiveness of microcloths and how they clean surfaces. And that's the proper way of doing it. But we have to teach everybody that the solutions that we're using for disinfectants have an efficacy to actually remove the virus. And secondly, we have to talk to them about the cleaning process to make sure people understand. For example, I was in the bank prior to this pandemic hitting and the lockdown. Okay? We had people in the bank who would squirt the disinfectant on the surface where the banker tellers are located. Okay? Where the public would lean their arms on the edge of the table. And they would wipe that down. And then they would stand off to the side to allow the next person there. They would never change that cloth. And the type of cloth they were using, I could see what they were doing. They were just smearing around because they didn't understand the process. So defining the process is so important, which goes back to what they were already talking about, is developing an overarching work plan. Whether you're on a construction site or in a small business, develop your work plan that works for you. Okay? So that's really the key. Write it down, the steps that you need and your workers need to follow to prevent them from getting exposed, as well as protecting the public, unfortunately, because they don't sometimes get it or care enough to make sure they're not transmitting the virus to your workers.
That is fantastic. So at this point, I want us to appreciate for 10 and also else for all their input, training, and impartition for this class. I want us to do a shout out to these two and to other people who have contributed and asked questions and make input. Can we all clap for everybody and clap for all of us, please? Yes, thank you, thank you, thank you, thank you, thank you. For closing remark at this point, let's Richmond just do 1 minute or 30 seconds closing remark, because I believe Benin have so many things and we all have to get back to work. Many of us are all attending from our various offices, and those that is at home, that are at home, fine. You start home and stay safe. Okay.
Thank you.
Yeah, thank you very much, and thank you, Mr. Fontaine, for the presentation. We've learned a lot. We've learned a lot. At this time, I want to thank everybody for coming on board this particular third program. And I know this is not going to be the last, and those on board are going to invite their friends to join this very program, as it's very educative. Thirdly, I would like to encourage those who are using their phone as signatures to change it the next meeting day, because it's not proper to call you by your phone number like Galaxy 97. I mean, it's not proper. You have a name, so you sign in with your name so that we can really identify you by your name, but not your phone number. It's proper. Secondly, we would also like to see the faces to know whom we are dealing with. It's also very a good thing to do. It's a good thing to do. Show your face so that we know whom we are dealing with. Maybe I may come from Ghana to Nigeria and I may meet you at Lagos, and I will just bypass you because I didn't see your face. You get it? November, I'm coming to Nigeria for the conference, so I would like to see your faces. So when I meet you on the way, I can identify you that Mr. or Mrs. so and so is very good. So cheers. And also the last thing is, please get very close to your books and make sure you learn and learn well what is in your books. Do not just read as you read a newspaper, but read to understand. If you read to understand, it becomes part of you. And safety is a breath. Once you breathe in, you breathe out. You breathe safety in, you breathe safety out. Meaning whatever you learn into your system, that is what you are going to portray. So you breathe in and you breathe out. So as you learn as you are breathing in and you are breathing out. Thank you so much. We'll meet on the next scheduled meeting.
Thank you so much for that wonderful charge. You know, he said we need to be seeing our face and also write our name. That is security wise. At least there is a high level of hacker. But I believe professionals are here. So you are all welcome once again. And again, he was talking about studying. It's very key. Make sure you study and study well. And we'll be reaching everyone again for evening session, and that is going to be from Dr. Reginald, who will be speaking to us from Canada. So he will be giving us a foundation class from Canada. That's going to be evening, 6 p.m. UK time, Nigerian time, and possibly 5 p.m. Ghana time. And I will send you all the information so that you can check your timing depending on the country where you are connecting us from. I appreciate everyone, and on behalf of my team and my leaders and the fellows of this institution, I welcome you to this training session. At this point, I want to unmute everybody to do a shout out and make your noise in just a few seconds.
Can I, just before that,
Okay.
Can I make a remark, please?
Okay, go ahead, please.
I know for a fact that not all questions have been answered. Well, all questions have been answered, but only in one way.
Okay.
I know certain people meant their to ask a different question, well, a different angle. They asked the question in that it was answered. Please keep asking until you have your answer. It's important. Please do that. You're here to learn. Don't be shy. Ask your question until you get the answer that you wanted to, well, not that you wanted to get, but an answer on the question you wanted to ask. And it was interpreted wrongly. So please do that.
Thank you so much. So, Ms. S, I have charged you now is to keep asking your question and don't be shy. So we are in a classroom. I can see everybody. You know, we are in a global village now where everybody can see everybody, irrespective of the country where you are. So we are seeing everybody. Ask your question, raise up your hand, or maybe you drop. We are going to sort out the writing box before the next class in the evening to know what goes wrong from the IT unit. At this point, I unmute everybody. So you make your noise in a few seconds and charge our trainers. 410 have been awake since 4:30 a.m. United States time. So he have done a great job for us. I appreciate you for 10. So you are all on mute now. You make your noise and shout out to them.
Father said either, so that's how people are. So you cannot prevent everything, but as long as there are rules, and that is where you should advise the company leaders, the bosses in. If you can have rules, you the responsibility from the company actually, and then it's the employee's responsibility if something goes wrong. Although you of course need to improve that constantly, and it doesn't mean that you can't say anything anymore. You still care for those people, otherwise you don't get into this profession. So yeah, an important job with a lot of responsibility and a lot of possibilities. When I hear this, that there is a lot to do in Africa, for example, that isn't organized by the government, well, then I see a lot of job opportunities for specialized companies to measure things and so on, and to promote that to companies. So it's, yeah, full of possibilities. Welcome to the club.
Thank you so much. As I've said it all, you know, but there is something else, there is something you do not understand. When you hear Mrs. Kurtz was talking about buildings and all that. In Africa, like in Nigeria, in Ghana, everybody is a builder. Everybody is a builder. You know, everybody is a builder because they will just call the builders, buy their cement, buy their sand, and just go to the land and point hands and just do toilet have to be here, kitchen have to be here, this one have to be here. And by that, they will just tell you, make sure this one bag of cement, you use it for 60 blocks. If you don't mow 60 blocks for that one bag of cement, you are in trouble. They won't pay you. So that is how some of these buildings are done. There is no integrity test. There is no monitoring by the government to find out are they put into compliance. So in Europe, it's different. We're in another world. Africa is in another world, and they are still trying to understand how the Western world operates. So that is a big challenge on its own. I don't want to enter into that issue now, because if we enter in that issue, we won't sleep tonight. So let's just take it that we have to keep doing our own best. As she has said, you have to try your best to make sure you want to save lives. If you don't want to save lives as an executive, to save lives of your employees, as a safety professional, to save lives of your co-workers in an organization where you have the responsibility, that means you don't have to get into this. That is the foundation we are in now. So at this point, she has welcomed you on board as a safety professional and as an expert in this field, a master in that matter. I also salute you all. Thank you. So at this point, I just want to, Mr. Richmond, you know, we have said it all. Can you just give us a closing chart of 20 seconds? That's my co-host.
Okay, thank you. Thank you very much. Thank you very much. And thank you all for this evening session as well. We've all done great, but all that I would like to say for this evening's presentation is, as safety officers or practitioners, we don't blame. We don't have to practice a blame game, but we should always look at the issue at hand and handle it as it is. So blame game should not be part of our daily living, but we should always be focused on handling the issue and handling it very, very well. That is all I'll say for this evening. So we'll meet, God willing, tomorrow, and we'll continue from there.
Yes, we'll be meeting possibly tomorrow evening. So tomorrow evening, because of those that are going to work and all that, especially more of people in Nigeria, in Ghana and all that. So we'll meet tomorrow evening. I will sort out with our speaker for tomorrow evening to find out the appropriate time.